a resident overall is part of your training to become a board certified physician. So when you graduate medical school, you're a doctor, but you're not board certified in any specialty. So you apply to the specialty you're interested in. For me, that was family medicine. There's definitely some big differences between being a medical student and a resident. As a medical student, you kind of have two goals. So as a medical student, you perform 2 years of academic medicine, which is like classroom based. You have to kind of learn the basics. You have to start somewhere. And then your third and fourth year, you do what's called clinical rotations, and they're kind of twofold. It's one part of it is so you learn everything about different specialties, so that eventually when you're a physician, you at least have a background in things that might not be your specialty. The other component of it is you're kind of learning what your passion is. So you do everything from internal medicine, surgery, OB-GYN, emergency medicine. You can do different electives and specialties like neurology, cardiology, nephrology, etc. You can literally do everything as a student, and you're kind of going through that journey to not only learn and absorb as much as you can, but also to pick what you want to do. Day to day, as a resident, it's vastly different depending on what you're doing. In the office, so when you have a clinic day, your typical day will start, depending where you're at, around 7 or 8 a.m. You'll come into the office, you'll want to review the patients that are planning on coming in, that are scheduled to specifically see you. You'll go over their past visits, learn a little bit about their history if you've never met them before. Check out labs, maybe if they were here a month ago and now you're following up, and you kind of determine why they're physically coming into the office. And you just want to do like a little bit of prep work. Then as the morning progresses, your patients start coming in, and then your typical day is you go into the room, you introduce yourself, you say hi, you perform your history, so you get all the information from them, why they're there, what's going on. It could be an acute problem, it could be a chronic problem that they're managing, they could need new medication refills, they could be there because they have to have a surgery and they're there to get what's called a pre-op clearance. And then you'll see them, you'll figure out what your plan is, do your physical assessment, discuss with them a plan, and then when you leave the room, you go to your preceptor, who's the doctor who's over you, kind of managing and making sure you're making all the right choices, and you present your case to them. I met so-and-so, they told me about this, this is what I want to do, and then your preceptor will come in and see the patient with you, and then they'll kind of confer and either agree, disagree, or kind of tell you some other ways to optimize your care. And over the span of doing this over 3 years, you really kind of absorb a lot, because it's kind of just lots and lots of practice and repetition. So a typical hospital day starts much earlier. So typically I'll get to the hospital around 5:30, 6 in the morning, immediately start chart reviewing, figuring out what changes happened overnight with my patients, what new labs might have been drawn, what the results are. And then you're going to do what's called pre-rounds. So you're going to go physically see your patients, discuss with them, ask them about their symptoms, see if anything's changing, if things are improving, if things are getting worse. And then after you pre-round and gather all this information, you do what's called rounding, which is kind of a classic, it's the cornerstone of medicine. Is you have your attending, you walk around as a group, and you literally go from room to room, and you present all this information to the attending. Everyone sees the patient together. And then you have a group discussion where you discuss their care, if you want to continue with the current plan, if you need to modify, if there needs to be any changes. And then after you finish rounding, you physically, as the resident, implement all the changes that you discussed on rounds. So you'll do all the orders. And then kind of after you do all that, you get all your notes in for the day. You'll call patients' families. So you'll call families, give them updates, have discussions with them. You'll also kind of follow up on whatever your plan was. So if your patient's getting imaging, you're going to go, right after they get the imaging, you're going to pull it up, look at it, get the reads, and then you kind of throughout the day start acting on the results that are coming in and the changes you made. Later in the afternoon, you want to re-see your patients. You made a change. Did it work? Did it not work?
So this is the day in the life of a first-year family medicine resident. Thanks so much for following me around today.